Hello friends, in the 8th week, we are going to focus on crucial phases, focusing on the physical, emotional and spiritual dimensions of palliative care. This is also related to the symptom management. Intestinal obstruction in palliative care, stoma and skin care is the one of the chapters which we are going to talk. You know what is stoma? Hole in your body. When with the surgical intervention, we create a hole for the passage of urine and stool and something, some other excreta from your body. That hole should be clean and it should not affect the local skin. The skin care nearby stoma, that's called the pre-stoma skin. This is most important. We are going to talk about that. And the wound care and skin health. The bedridden patients develop bed sores. So in that case, diabetic foot patients are there. Wound healing and the skin care is also important. These are the aspects which we are going to talk in this week. Stress and burnout. This is another important part we are going to talk. And the intestinal obstruction, focusing on comfort and symptom relief. The symptom, stoma and skin care, role of stoma in advanced cancer symptom. Pre-stomal skin care, Ayurvedic agents like Haridra, Yashad Bhasma, Jatyadi Grit, Jatyadi Tel. What is the role of these medicine that will be discussed? And step by step, practical care techniques will be discussed. Wound and skin health in immobilized patients, that is a bed sore, that is another important aspect we are going to talk about. The understanding the pressure ulcers. What is the pathogenesis of pressure ulcers? The change of posture may help in the patient skin care. That has to be discussed. That will be discussed. The diabetic wounds. Allopathic and Ayurvedic dressing methods will be discussed. Preventive and palliative strategies in wound management and skin care will be discussed in detail. The importance of hygiene, nutrition, and caregiver education will be discussed. Besides that, there are the two important topics: stress and burnout of the patient and of the patient family. Both will be discussed in detail. And under this topic, we are going to talk psychological challenges in patient and the caregiver. What are the challenges? Early symptoms of stress and burnout. The table will be taught to you so that you can diagnose the early symptoms of burnout. Burnout is the result of persistent anxiety and stress. If persistence of anxiety, stress and depression is there, the patient or the patient family ends up to the burnout, which is difficult to manage. So it is better to manage in the early stage when burnout has not started. So this diagnosis is very important. We are going to talk about that. And we are also going to talk mind-body-spirit integration and resilience in the patient. So more specifically, there are 4 topics which will be taught by our subject experts. These are the intestinal obstruction in palliative care, number 1. Number 2, stoma and skin care in palliative care. Wound care in skin health in palliative care patients, like the pressure wounds will be basically discussed. And the stress and burnout part 1. In this way, we will finish our this week study, 8th week study. So compassion for other begins with compassion for ourselves. This is the slogan which we are going to talk in this. Our team members will deliver a specific talk. Let us begin to study, to learn in this 8th week of our course. Thank you very much.